Hello class, my name is Manuel Sosa and today I'm going to be talking about the diagnostic criteria and treatment options for patients with diabetes mellitus type 1 and type 2. With that said, I will begin. So the diagnostic criteria for diabetes 1 and 2 are the same. There's a patient would have to test positive for one of the four different criteria that I'll be presenting, and the first one is the glycosylated hemoglobin A1C. And this would be a value greater than 6.5%. Glycosylated hemoglobin is measuring the amount of sugar molecules that are attached to the red blood cell, and this gives us a snapshot of roughly 120 to 20 days into the patient's past. So this would indicate that 120 days would be indicative of the average lifespan of a red blood cell. So the more glucose attached to the red blood cell, the higher the average blood glucose is for that person. The second criteria is to have a fasting blood glucose greater than 126 milligrams per deciliter, and this is typically done in a fasting state, so roughly 8 hours. And the patient will test positive if blood sugar is greater than 126. The third option is a 2-hour plasma glucose, and this value that would indicate a positive result would be greater than 200 milligrams per deciliter, and this is typically done during an oral glucose tolerance test. The oral glucose tolerance test would test the patients in a fasting state. Baseline blood sugar is taken, and the patient is then given a glucose solution to drink. Blood sugar is then tested 2 hours later, and a blood sugar greater than 200 would be a positive result, as this would indicate that the patient does not have sufficient insulin stores or production to decrease their blood sugar to a more tolerable state. And the fourth criteria is to present in a hyperglycemic state to an emergency room. The patient would also have to have positive signs and symptoms. This would include ketone bodies in the urine, the polydipsia, polyuria, fruity odor of the breath, and similarly, the patient would also have to have a random blood glucose greater than 200 milligrams per deciliter. So if your patients were to ever meet any of these four criteria, even if it's just one, they will then be diagnosed as diabetic.